Hello friends, welcome to another set of EFA Exit Exam Questions with their answers. We have tried to cover all the commonly asked questions in the EFA Exit Exam. So to support our cause, please press on the like and subscribe button. Question number 1. The proper stimulant of unconscious person is A. Tea, B. Coffee, C. Whiskey and water, D. Ammonia inhalant. Correct answer is D. Ammonia inhalant. Question 2. Heat stroke affects body's vital organs except A. Brain, B. Heart, C. Kidney, D. Bones. Correct answer is D. Bones. Question 3. When performing abdominal thrust, how many thrusts do you do? A. 1 to 5 thrust, B. 6 to 10 thrust, C. 15 to 20 thrust, D. 30 to 40 thrust. Correct answer is B. 6 to 10 thrust. Question 4. What does ABCs for first aid stand for? A. The letter in the alphabet. B. Air breathing concentration. C. Airway breathing circulation. And the correct answer is C. Airway breathing circulation. Question 5. If someone suffers heat attack and had ceased breathing, you should A. Immediately give stimulant by force if necessary. B. Make the victim comfortable in a bunk. C. Immediately start CPR. D. Administer oxygen. Correct answer is C. Immediately start CPR. Question 6. If a person is choking, you should do nothing as long as A. They are coughing. B. They are still conscious. C. Their face has not turned blue. Correct answer is they are coughing. Question 7. A communicated fracture is one where the bone has A. Broken into pieces which are floating. B. Broken where only part of the bone is fractured. C. Broken cleanly with each end attached. D. Broken and is affecting muscles and nerve. Correct answer is A. Broken into pieces which are floating. Before giving CPR, you should make sure A. They are not bleeding. B. They are conscious or unconscious. C. Are not vomiting. D. Are not dead. Correct answer is they are conscious or unconscious. Question 9. BLS is A. Basic life science. B. Bend, lean and support. C. Basic life support. D. Basic living support. Correct answer is C. Basic life support. Question 10. In order to initiate CPR on a drowning victim, A. Start chest compression before the victim is removed from the water. B. Drain water from the lungs before ventilating. C. Begin mouth to mouth ventilation. D. Do not lift the head back since it may cause vomiting. And the correct answer is C. Begin mouth to mouth ventilation. Question 11. You are alone and administering CPR to an adult victim. How many chest compressions and how many inflations should you administer in each sequence? A. 15 compression, then 2 inflation. B. 15 compression, then 4 inflation. C. 30 compression, then 2 inflation. D. 30 compression, then 4 inflation. And the correct answer is option C. 30 compression, then 2 inflation. Question 12. The objective of first aid is A. To diagnose an injuries and conditions. B. To determine priorities. C. To give immediate treatment. D. To shift patient to hospital. Correct answer is C. To give immediate treatment. Some people are very allergic to insect bites and stings. This condition is known as A. Septic choke. B. Cardiac arrest. C. Toxic shock and syndrome. D. Anaphylactic shock. And the correct answer is D. Anaphylactic shock. The content of the first aid kit include the following except A. Micropore. B. Macropore. C. Bandages. D. Scissors. And the correct answer is B. Macropore. 15. The goal of medical services is to provide A. satisfactory treatment of male semen, B. provide treatment for those in need of urgent Medicare, C. to provide help to seamen in time of financial need, D. to provide help in the sea of disabled people. Correct answer is B. Provide treatment for those in need of urgent Medicare. Question 16. Symptoms of hypothermia except A. Stumbling, B. Amnesia, C. Anemia, D. Hallucination. Correct answer is C. Anemia. What is the process of heat loss through sweating called? A. Conduction, B. Evaporation, C. Radiation, D. Convection. Correct answer is B. Evaporation. Unconscious and death occurs at the temperature of 90 to 86 Fahrenheit, 86 to 90 Fahrenheit, 86 to 82 Fahrenheit, 82 to 78 Fahrenheit. Correct answer is 82 to 78 Fahrenheit. Providing every effort is made to preserve body moisture content by avoiding perspiration. How long is it normally possible to survive without water? A. Up to 3 days, B. 8 to 12 days, C. 15 to 20 days, D. 25 to 30 days. And the correct answer is B. 8 to 12 days. Which of the following signs may go away as the hypothermia worsens? A. Slurred speech, B. Confusion, C. Shivering, D. Unconsciousness. And the correct answer is C. Shivering. Friends, hope you found this video useful. Make sure that you watch the next part too. I wish you all the best for your exam.